Hello everybody, my name's Deanne and this is Deidre, and we're going to be talking to you about what we've been doing up on the Gold Coast. We're going to talk a little bit about how it all came about, what some of the challenges we've faced, some of the successes we've had, and we're going to talk a little bit about some models that we've used in the data that the Elder Abuse Prevention Unit have collected in supporting some of the cases that we've dealt with. So in late 2015, my supervisor, Les Jackson, he went down to the Gold Coast. We're based in Brisbane and we're a statewide helpline. We went down to the Gold Coast to do a session with the social worker practice group on the Gold Coast, and it went quite well, but they had some feedback. It was mainly Deidre had the feedback, but it was really constructive feedback that some of the referrals we were making and some of the organisations we were referring to weren't always meeting the needs of the clients that they were dealing with. So Les decided that I needed to go and help Deidre fix that problem. So we met, and over a period of probably 3 or 4 months, we came up with some ideas, we looked at the cases, and in June 2016 we held our first meeting. And what we needed to do was to identify who would be involved in this project. And there were people, when social workers, particularly in hospital settings, were making referrals to organisations like QCAT, which is the Administrative Tribunal in Queensland, and the Public Guardian, who do investigations for people with impaired capacity in Queensland. Some of those, the communications there weren't always working. So what we wanted to do was work together, work collaboratively to work a way forward for our clients and also for our organisations. Just to note, the organisations in red are different to the ones in black in the sense that what we then developed were 2 groups. We had a reference group which meets quarterly, and we discuss ideas about further education or further awareness of elder abuse on the Gold Coast, aimed more at older people. It also provides an avenue for all of our services to share what we do so that we have a better understanding of how we're all going to work together, because we all have limitations. And also the groups in red, they were part of a response panel, and it was to deal with critical cases of elder abuse where the social workers in the community or in the hospital setting weren't really getting the result that they wanted for the older person. And those organisations came together via phone, and the benefit of that was that organisations like the Public Guardian, the Queensland Police, QCAT, who had very little time, were able to pick up the phone and have a quick 30-minute discussion about a case and then go on with their day. And it helped the social worker who was bringing the case forward, and it gave them momentum to then deal or hopefully support their client in a much more proactive way. So some of the successes of that, I think I've mentioned a few, but the idea of sharing information, we now have a much better understanding of what each other do, and we know what we can't do sometimes and what we can do. We also appreciate the fact that a lot of these services have put in extra time and effort above and beyond what they normally do, and again that's a huge commitment from those large organisations. I also haven't mentioned ACAT, which are a really key player for us in the health area. So I'm going to hand you over to Deidre. She's going to talk about some of the challenges and how we've measured the success of this.
So some of the challenges that we found that we were faced with in this whole process, particularly as we started to work through and we're meeting, and I guess more so in regards to the response panel, where we sort of found most of the challenges basically. Information sharing was certainly one of them, in terms of having different stakeholders involved who came from, I guess, different legislative frameworks as well, and that sometimes impeded their ability to have open conversations. Ideally, we wanted people who were brought forward to have given consent where possible in order for us to be able to openly discuss them. There was greater benefit when this happened in terms of the fact that having the OPG sitting in on those meetings, as well as QCAT, say, for example, they were actually able to access their databases during the course of the meeting and identify any sort of input that they might have had with that particular person, which was actually really helpful, because quite often that can actually be quite challenging in terms of being able to access that information, and it can be quite pertinent to what response we may have been able to provide. So when we weren't able to get consent, there were obviously limitations at times in terms of how we could go about discussing that particular case, and we tossed around ideas of de-identifying, and that, I guess, is the last resort where we're needed in order to at least have some sort of a conversation and get some sort of direction without identifying, but we, again, found that that could be quite limiting. Time constraints was definitely another challenge as well, just in terms of the fact that there's been no funding that's been attributed to this particular project, and it has basically been, I guess, just donated time from all of us in terms of and identifying a need and being passionate enough about the topic to want to pursue this and obviously hopefully make an impact on older people's lives that we might be discussing as well. So I think that was probably most of the challenges that we sort of had. We wanted to start to measure the success. I won't use the term that I might refer to us in terms of how we went about doing this, but research, I guess, and evaluation is really, really important, I think, in terms of moving forward with this, and we kind of went about things the other way around. So we've started to really seriously consider how we can measure the success of the panel, and in doing that we've started, it's always been part of our process, but it's been done quite informally throughout the stakeholders meetings and meeting regularly, inviting people to provide feedback and any suggestions in terms of who else they thought needed to be involved in terms of additional stakeholders, word of mouth, all that kind of thing as well. So some of the responses that we've had today in terms of more formally when we did send out a brief questionnaire recently was that people identified that the network's always positive and provides opportunity to appreciate how the other agencies respond. Generally enhancing knowledge base and creating context for when future issues arise as well. And a coordinated approach is the best method where possible. A couple of other ones there, just in terms of giving the opportunity to learn more about what the other services do. That's been a really key thing in terms of our model of delivery, as well as giving stakeholders, like Deanne was saying earlier on, the opportunity to actually talk more about what they do, so that there's hopefully a much better understanding amongst the stakeholders locally who might have a response as to what others do, so that again we can have that more coordinated response. And also identifying sometimes where to go, who do you talk to in these types of situations. Some feedback recently as well was that the reference group needs to have more diverse membership, and that's certainly not something that was done in a sense to be exclusive in any way, but again it was probably more around time constraints as well, and using that word of mouth to actually get the project out there, and the door remains open, and hopefully our membership will continue to diversify. I'll hand you back to Deanne.
Thanks, Deidre. So the Elder Abuse Prevention Unit helpline collects data when people call us, and this year we've done a year in review, which we do every year, but it has brought to our attention some different models of abuse. I mean, we talk about the traditional models of elder abuse around financial abuse as the main one, but we did look at some very small samples where the domestic violence model was more prevalent in certain types of abuse. Now, so most of you would understand or relate to DV as obviously a high physical, psychological, sexual abuse as being the abuse types. We also noted with the carer stress model that it was more about neglect often, not always intentional, and often psychological. So with the three models, there's always, it appears psychological abuse is involved in all of them, but it's a different form in a lot of cases. So we're really hoping to drill down next year and ask more questions around that. But while we're giving you that information is that when we were doing the case discussion, so with the response panel that we set up with the organisations like QCAT and the Queensland Police and the Public Guardian and ACAT, we needed to look at what sort of support was needed. So in some cases the police were really critical in that case discussion. In other cases it was more an aged care response, or it was more a legal response, or the guardianship response. So this sort of identifies, I suppose, some of the areas where we have had a different need for approaching elder abuse in a different way. So I'm going to hand you over to Deidre to really quickly go through some of the cases and just look at how they reflect on the model.
Okay, so as mentioned, we've got the three different models that we were sort of looking at. And the carer stress model was the first one that I was just going to give a brief case study around. And so we've had quite a few cases come forward to the response panel today, but the one that we felt best was allocated to the carer stress model was an elderly couple who were being cared for by their son, who had his own health and mental health issues as well. The elderly father didn't have capacity, was also considered to be palliative, and there was a escalation in their situation at home whereby a physical assault occurred from the son to the father. The police were contacted and came out, and a domestic violence order was actually applied, led by the police at that point in time. The son's mother was initially relieved, I think, to have that sort of input. We were able to get them some emergency respite as well and get them both safe. That quickly turned, though, to her feeling really constrained by that and not wanting to have that domestic violence order. She really wanted her son to come back into the home environment and continue on with the caring role. And her insight at times appeared to be somewhat limited around the fact that she wanted to have the domestic violence order revoked and felt that he wouldn't do this again. So I guess there's some elements of the cycle of domestic violence in that as well, but we certainly felt from a carer stress model that this sort of best represented that particular one. There was obviously some ongoing input with that family that we were able to provide as a response panel as well. So the next one was a domestic violence model, and this was another elderly couple where consent was provided. Consent was provided for the first one as well. There were concerns around capacity that was fluctuational for both of them. Really long-term input from significant stakeholders over probably a period of 6 or 7 years, where this case is just sort of cycled over time as well. Previous domestic violence orders were apparent for this particular couple, and there were ongoing allegations to Queensland Police Service as well by the female in regards to DV with her partner. Again, multiple stakeholders involved in these particular situations, so it was quite a challenging one. Then there was the elder abuse one as well that we were going to refer to, but we've run out of time. But hopefully we're making a difference. It's certainly something that we've been really passionate about and continue to be passionate about, and it continues to evolve with us as well. So thank you for listening today.
Thank you. That was a great presentation. For me, again, I'm just sort of putting the summary from each of the... So the importance you highlighted of inter-agency collaboration and passion for the work that we do. And in terms of our challenges, again, it's lack of resources, lack of time, structural barriers, and also legislative framework around information sharing. These are common themes that are coming across. Now, the next presentation it's a matter of trust, collaborative community education and awareness raising program in diverse communities. Kate Gibson, Community Legal Centre, and Fadak Al-Fayan. They'll be the two presenters for this.
Yes, sir.